Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Hello, everyone. Welcome. My name is Dr. C. Chen, Physician Director of Practice Sustainability at the AMA. On today's podcast episode, I'm joined by Dr. Jennifer Thomas, family medicine physician, addiction medicine physician, and medical director of Morris Hospital's Integrated Behavioral Health Program. Thank you for joining us today.
No problem. Thank you. It's nice to be here. Thank you so much, Dr. Chen.
So before we begin diving into sort of our talk today, could you share more information about yourself with our listeners?
Absolutely. Happy to. So my name's Jennifer Thomas. I'm a family medicine provider by background, and I practice in Morris, Illinois. So Morris is kind of northern Illinois, kind of the collar region around Chicagoland. So definitely more of a small town rural practice setting. And yeah, my background with integrated behavioral health kind of came out of necessity. It was sort of that obstacle turned opportunity. I was the PCP in the exam room with patient day after day, finding that, we just didn't have enough resources for all the behavioral health needs that came into my primary care office. Like so many of my colleagues, you can do some level of screening and diagnosis, but sometimes there's things just outside of our reach and comfort zone as primary care providers. And our system struggled, like most do, with, well, how do we solve the behavioral health challenge, right? Do we hire more psychiatrists? Do we refer everybody out? And my experience, really what transformed our health system was learning about what we call behavioral health integration or integrated care. So how that looked for me was I stumbled on a training program in 2018 and learned of the collaborative care model. So collaborative care is an approach where the primary care provider gets two extra teammates, a behavioral health care manager, so that's a counselor or a social worker, and a consulting psychiatrist. So the three of you together with the patient are helping diagnose and treat behavioral health conditions in the primary care space. So it's really equipping PCPs to do more in their home medical setting to meet the needs of patients' behavioral health needs, rather than just saying, here's a referral, good luck finding a specialist, because we know that often doesn't get the job done. People don't connect with the providers they need the moment they need them. So integration is just a real practice change philosophy. It's helping us think of primary care as a place where we can add in behavioral health services and try to address the whole person. So yeah, that's how we got started with collaborative care. This was 2018. We learned of the model. We were fortunate in getting some implementation coaching from the University of Washington Ames Center. They were phenomenal implementation coaches for us. We joined two of their research studies and really got that hands-on weekly implementation coaching to build a collaborative care model at our health system. We started out in 2019 with my office in Gardner, Illinois, and then our OB/GYN practice in Morris, Illinois. And we launched collaborative care. This was February of 2019. So we had 6 providers referring then, and it really took off. The patients, the providers, they really saw the need to, really develop behavioral health resources in the primary care space. So now we've gone from 6 to now we'll have 38 providers in our primary care team with accessibility to collaborative care model coming up this summer with an additional care manager we've hired. So really happy to see that level of integration take off in our health system.
I'd love to hear more, Dr. Thomas, about sort of how Morris Hospital's behavioral health program has sort of impacted patients on a day-to-day basis. What have you seen? What impact has it had?
Yeah, that's a great question. It's had a tremendous impact. And integrated behavioral health really is transforming primary care. It's developing and delivering really good primary care. It's saying, behavioral health is health. It's part of the whole person package. So rather than, thinking of it as an other entity and a referral out to a specialty center, it really helps us think of ways we can empower the team to do more behavioral health screening and treatment right in the primary care office. So that may look different for practices. On the pediatric side, we're doing a lot more behavioral health screening at our well child visits. On the OB/GYN side, universal screening for depression and postpartum depression issues. And in primary care, we know that of the vast majority of visits, I think the stats are about 2/3 of visits that walk through our doors are for behavioral health conditions. clinicians. So with programs and models like collaborative care, we can really meet people where they're at and do a better job of connecting people to services when and where they need them. So yeah, it's been a really exciting implementation journey. We had to do a lot of learning, and we were very thankful for resources like the AMA's BHI Collaborative. They have a beautiful compendium with resources. It says, okay, if you want to do integrated behavioral health, where do I start? How do I code and bill for this? Because that's the first question, right? Everybody asks is it financially sustainable? And it is. There's really wonderful resources with the AMA BHI Collaborative Compendium that talk through BHI billing codes. So we mentioned the collaborative care model. There's a whole set of CPT codes to bill for that. On the PCBH model side, there's psychotherapy codes and health and behavior codes that we can bill that are really a knowledge gap for a lot of people just like me that are medical. They're like, oh, I didn't even know those codes existed. I hadn't even envisioned a world where I could have behavioral health people in my medical practice and be able to bill for their services to keep the doors open and keep that clinician in my practice. So I'd really encourage listeners, if you're interested in this type of work, do some looking on integrated care and billing codes and financial sustainability, because it will probably really inspire you to get creative and rethinking how you do your day-to-day clinical work.
So I think a lot of our listeners are probably just embarking on this journey into integrating behavioral health in their practices. They're probably going to come across some obstacles or some challenges. Can you tell us what kind of pitfalls or challenges that you've experienced in your implementation of BHI?
Yeah, absolutely. There's many. Like anything in medicine or primary care, it's messy, right? It's not a neat, tidy package. You kind of have to build the plane while flying it, right? Like the analogy. So the biggest tip I would suggest for listeners getting started in implementation is try to create a shared vision, or really put into words your mission. What are you trying to do with integration? Is it trying to, improve the lives and the health of the people of your community? Is it bringing behavioral health into primary care? And when you have that mission statement solidified, it's critically important to assemble the team. And that's everybody. That's your C-suite, that's your office managers, nursing, and your front-end reception staff. All of them need to be on the same page to know that this is a practice transformation philosophy. We're really, changing up the script on who's part of primary care. Pitfalls, there'll be lots. Nothing is ever smooth in healthcare, especially on the early innovators side. But, I think it's going to just be a very user dependent. Everything that we do is based on systems, right? So we might have to get outside of our comfort zone, get in with your C-suite and have a presentation on, hey, this is what integration is. This is how I can lead this. Have some meetings with your revenue cycle team, billers, credentialing, just because these are new roles, maybe some new codes your team and your system hasn't used past. So define your team broadly, get together, meet regularly, and keep in mind that North Star of the mission that you're working toward. Because it's bumpy, but it's worth doing.
Wonderful. I know you have shared today some of the AMA resources regarding integrating behavioral health into practice. Are there any other resources in general you can tell us about that have helped you?
Yeah. So one of the other amazing opportunities I've had as a clinician is being involved in integrated care member societies. A big one, the national leader, is CFHA, the Collaborative Family Healthcare Association. I've been involved with that organization for years. I served on their board, and just this March, I was given the opportunity to serve as their national medical co-director on integrated care. So that's given me a really cool lens to really look at this integration concept nationally on how do we really reach, primary care teams. How do we empower them to look at building this type of work in their home clinics? CFHA is an awesome organization, and it's kind of a best kept secret in medicine. It's been around 30 years. There's over 2,000 members in all 50 states, including Canada. So a lot of behavioral health clinicians, LMFT, therapists, psychologists were kind of the founders. But also then even 30 years ago, we're really mindful that primary care, these are our partners. We need to be working in the medical space. And those, innovators, forward thinkers, even 30 years ago, founded CFHA. So I'd encourage listeners to give them a look. But yeah, CFHA has amazing resources, in-person conference, a virtual conference each spring, a lot of really neat work groups and special interest groups where you can not only learn, but also then build a community, because you're going to need people to run things by when you hit those bumps, those implementation hiccups. It's like, is this just me? And finding, nope, there's somebody out there that's been through this journey of implementation, had those pain points, navigated through them, and just to have that camaraderie to keep going, it's going to be vitally important for those implementation leaders. So I definitely check out CFHA if you're at all thinking that integrated care speaks to you.
Are there any other practical tips or pearls of wisdom for other healthcare leaders who might want to start their journey towards integrating behavioral health?
Yeah, I would say that, keeping an open mind, these really great missions like AMA, VHI Collaborative, CFHA are really kind of redefining that whole person care. Behavioral health is health. The body and the mind, they're connected. So the more we can do to try to equip our teams to do that in one setting, it helps patient outcomes. It helps reduce healthcare costs. It's actually really rewarding to feel like you're working with an interdisciplinary team and helping people get better quicker, right, in your own medical office. So I think keep an open mind. It's something that you might get your foot in the door and might find that it speaks to you, even if you never thought that psych or behavioral health was kind of your cup of tea. You might find that it's a really surprising new chapter for your practice.
Thank you so much for joining us today, Dr. Thomas. It's been a pleasure talking to you and listening to all your important insights into integrating behavioral health into primary care practices. Listeners can find out more information about the Behavioral Health Integration Collaborative and the other resources mentioned in today's podcast episode in the episode's description.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.